Cheshire Medical Center is our own local healthcare delivery system.
It really is a cosmopolitan-type hospital without being in a big city.
125 years ago, community members came together to start the hospital. Our region would be significantly different if the medical center wasn't here.
The community wanted care for everyone. There was a private hospital. The community responded by saying, we really want to make sure everyone in our community gets taken care of. Early on, the community contributed First Eliot City Hospital, which is the home of John Henry Eliot. As the community grew, it really moved on to Eliot Community Hospital, community donating $225,000 to make that happen.
The old Eliot Hospital had been a mansion, you know. In the operating room, there was a humongous plate glass window. It was most unusual. And yeah, it was getting crowded. The population was growing.
There was a time where we needed to have a true new healthcare facility. There was a donation by the community to build what now is Cheshire Medical Center, what we call the new hospital here on Court Street.
With all the changes that have taken place over the years, the one thing that hasn't changed is the care that this hospital and hospital community gives to the greater Keene community.
The hospital is in my neighborhood. It's something I've never really thought too hard about. And then all of a sudden, I have this crisis in my life, and everything that I need to do is associated with this hospital. Now, when I say that I went through cancer treatment, I felt it in my soul, I felt it in my mind, deep dark days when you just really don't want to deal with it anymore, and they were my cheerleaders.
Working for a community hospital is a real sense of purpose and a sense of family. Our staff, they live in this community, they work in this community, and really enjoy the ability to give back to their own community and their neighbors and family and friends.
There are people here and resources that you may not quite be aware of. Even though you have insurance, you have deductibles, and you have all these appointments and everything adds up. I truly realized that I needed some help and was able to reach out to the hospital to help me pay my bills and get me through my treatment without having to really have that stress of figuring out how I was going to keep my home and get my treatments.
Cheshire Medical Center, prior being Eliot City Hospital, really was about taking care of the community because the community wanted care for everyone. To this day, no one gets turned away because of their inability or ability to pay.
We provide a wide breadth of services to patients with all of the latest technology and advances that we find within those fields, so that our patients are getting the best of care that they would get anywhere else in the country.
Lived here for 43 years, really didn't need the medical center, but knew all along that if I did, it was here.
Well, no one plans to come to an emergency room. You don't wake up in the morning and say, I really want to do this. It's really the front door to our hospital for many of our patients.
I had the heart attack, totally unanticipated. The EMT care was excellent. The ER treatment here was excellent. They stabilized me, made me feel comfortable.
We are investing in our future. That includes things like renovating the emergency department, bringing in technology, investing in people.
So the changes in the ED since the renovation has definitely transformed the way we care for patients here. It helps us provide really better care. We have up-to-date cardiac monitors.
You've got a 22-year-old male coming in.
The tele-ED really helps the staff take better care of the patients. It allows me to be at the bedside with the patient while I have somebody else perhaps doing the documentation for me.
He does have a head injury.
Our teleneurology technology that we have can bring a neurologist to the bedside within moments. Both of his strengths appear to be equal on both sides. If somebody's having a stroke, perhaps they need a better evaluation.
The patient look at that picture and describe what they're seeing.
Besides just the technology feature, the department itself is bigger. It's more private. I have rooms that offer better air quality. I have better negative pressure rooms that make it safer for the patients and for the staff caring for them.
Renovating an emergency department is a huge deal. It would never have been possible without the support of our community and our community partners.
I just can't say enough good about my unfortunate experience. The doctor that heads up the ER explained that I was going to be going up to Lebanon, and cath lab was waiting for me.
By Cheshire being connected directly to Dartmouth-Hitchcock, when a patient goes up to Dartmouth-Hitchcock for care, there's connectivity. The preferences of what individuals want, it's seamless.
The coordination between Keene and Lebanon was just incredible. And the piece that really has kind of put me back together was the rehab program, and it was great to have it right here in Keene. That kind of close working together is just remarkable. And it all added up to a positive outcome for me.
The patients are being cared for in the highest quality and the safest way possible. We also have a large number of specialists here, both on the medical and surgical side. All of that, with the nurses, the technology, and the rest of our ancillary staff, our future is very bright to provide the care that we want to for our community.
The actions that have been taken to provide a much stronger foundation, both in the delivery of medical care, their ability to attract as quality providers, the alliance that has been put in place with Dartmouth-Hitchcock, formation of Cheshire Health Foundation really provides the recipe for success for decades to come. This community asset is worth the financial support, the volunteerism that's necessary to run a community medical center, and having it here for the next generation.
The community's always been there for the hospital, and the hospital has tried to be there for the community. So that constant is the commitment of the community to itself in terms of providing good health. When we talk about things like Healthy Monadnock, Vision 2020, or just health outcomes, the community has always really looked at that as something they valued.
We're talking about tobacco cessation and prevention. We're working with schools and businesses, various work sites. We're very involved in the issues around controlled drug use and the opioid crisis. We're paying a lot of attention to the other determinants that influence health. While the medical center is the lead or the backbone, we say, to catalyzing this movement, there are over 185 organizations in the region that have committed to participating in the Healthy Monadnock Initiative.
Taking care of each other is an important piece of who we are as Cheshire Medical Center and who we are as part of the community.
Never had a patient that I didn't like, and that's saying a mouthful. The people of this community, good people.
We're blessed to have so many services here that we don't have to drive 2 hours for. That's one of the reasons that I feel fortunate to live in the Monadnock region.
You know, I look back and I just sometimes don't know how I got through it all. But the support that I received financially and emotionally from the hospital, the nurses especially, will be held forever.
As we celebrate this anniversary and look towards the future of Cheshire Medical Center, it really is about how we're all better together. It's the fact that we have a community that's invested in this organization. We have a hospital and an ambulatory clinic that is invested in our community, and I think all of those investments are part of our commitment to not only our community today, but being here in the long run.